Hi everybody, my name is Mary Jarrah. I am doing my class webinar on Selective Mutism for our GE 502 class. I picked Selective Mutism for two reasons. One, I've actually had experience with a child who I believe had this learning disability when I was working with a group of pre-K students in high school. Two, my teacher, Dr. Marina, who I had in my teaching methods class, recommended I do this disability because it was interesting. And it definitely is. In case you were wondering why I have a flower, every time my fiance has given me a flower, I've taken it along with me. Whether it was on a debating trip to California, or my honors thesis for my undergrad, or for my graduation at my speech at graduation, I always had a flower that he gave me, so I figured since I had one, I'd put it in this introduction video. Thank you guys very much, and I really hope you enjoyed the webinar. If you have any questions, you can email me at marygarah12@gmail.com. You can find my email on this introduction page as well, and I look forward to hearing back from you. Thank you very much, and have a great day. Hello everyone! I just want to give you a moment to think about what selective mutism is. I have some questions that can stimulate your thinking, but I do recommend maybe pausing this video, taking out a piece of paper and doing a KWL chart. K standing for what you know about selective mutism, W stands for what you want to know, and L towards the end, hopefully, God willing, you will have learned what you wanted to know about selective mutism. I'll give you a moment to think this over before we move to the next slide. As directly quoted from the Encyclopedia of Special Education, selective mutism is a psychological disorder of childhood characterized by total and persistent lack of speech in at least one specific environment, such as the classroom, despite the presence of normal speech in other environments. The child is physically capable of producing normal speech and understands the language being spoken. If you're wondering what causes selective mutism, the answer is actually uncertain. There's many different causes and approaches to this question. So a recent shift in speculation de-emphasizes its precipitation by a traumatic event, such as sexual abuse or hospitalization, or its possible expression of oppositional behavior, but instead concentrates on a familial history and the presence of an underlying anxiety disorder. So some researchers have actually suggested that selective mutism be considered a behavioral manifestation of a social anxiety disorder. This researcher found that selective mutism is associated with developmental delay almost as frequently as with anxiety disorders, which suggests a neurobiological cause. However, on the other hand, the learning theory approach suggests that selective mutism is a learned behavior maintained by social reinforcement, whereas a psychoanalytic approach suggests that selective mutism functions to reduce a child's fear in anxiety-provoking situations through this unresponsiveness. As you can see in this image that I have in this slide, this child is choosing to write down what he wants to say. This child is not speaking. In the next slides, you will watch a video about what selective mutism is. Selective mutism. It is not actually defined as a learning disability. However, in this presentation, I will define it as a learning disability simply because it can adversely affect a child's performance. So since it can in a situation, it can be defined as such. Also, this slide just highlights how, as educators, students, specialists, parents, none of us should judge a child who is selectively mute, because it does not help them. The next video will just explain this.
Selective mutism is a unique form of anxiety or social anxiety that typically occurs in childhood. Selective mutism involves a child who does not speak or will only speak in certain situations for fear of being judged or critiqued. In many instances, children with selective mutism will speak to peers, but they won't speak to adults, or sometimes they will speak to their friends but won't speak to their teachers. Oftentimes, these children won't speak at school, but they'll speak and be quite rambunctious when they're at home. Of course, selective mutism creates great difficulties in school because it's challenging assessing the child's knowledge and helping the child when they may not understand what's going on in the classroom setting. Selective mutism has multiple different treatment strategies, and behavioral intervention is key. A child can learn how to speak and be more comfortable in those environments through a gradual succession of practicing and speaking and positive reinforcement. Selective mutism has a very good prognostic outcome when interventions are immediate. It's important to remember that when a child is selectively mute, not to consider them to be shy or rude. And it's also important not to put them on the spot and insist that they speak. This often exacerbates their anxiety and makes them even more less apt to speak in that situation. Selective mutism treatment requires the intervention of parents, teachers, and behavioral professionals, a collaboration that helps the child learn how to speak through small and gradual successions. Selective mutism is rarely understood, but these are a few facts regarding this anxiety disorder.
According to research that's been conducted by Morris and Ollendick in 2015, selective mutism is rare and usually occurs in early childhood. Many young children are worried when confronted with a totally new situation, such as entering school for the first time. Therefore, the diagnosis is not made during the first month at school. The mean age of onset varies between 2 and 5 years, but symptoms may become most manifest when children enter school for the first time and the problem persists at least 1 month. This disorder has a mean duration of 8 years, but it is possible even in adulthood. Sometimes in adulthood, the people may still continue to have communication problems, perform less well at school or work, and display higher rates of psychiatric disorders. Furthermore, there are several child's learning symptoms for selective mutism. For example, the key symptom is the total absence of speech in specific situations. Ford et al. In 1998 noted that children with selective mutism scored high on withdrawal and low on adaptability, which indicates that these children do not respond well to new or novel stimuli and do not handle transition and change well. You may ask, how can we identify this disability? Things that you can look for in a child include shyness, social anxiety, and taciturnity, which means being quiet in conversation. These are all commonly associated with selective mutism. Moreover, at a neurological level, aberrations have been found in some children with selective mutism that may partly explain the selective absence of their speech. So during verbal communication, there is a continuous interaction between speech and hearing mechanisms, and various mechanisms are operative to deal with incoming auditory information and to maintain production accuracy. So you can see that it is even identified at a neurological level. A child with selective mutism's most personal need would be reducing anxiety. How that's done will be something that will be discussed as we move along in this presentation. Why is selective mutism a learning disability in the classroom? Selective mutism is a learning disability in the classroom because it can affect the child's performance in a negative manner. If the child is worried or has anxiety or fear, this will cause the child to perform worse when it comes time to assessment. In the classroom, it's normal to see that a child may try to communicate with gestures such as head nodding, shaking, pulling, pushing. And this behavior is actually generally seen as a response to anxiety or fear of social embarrassment as a product of social isolation. The main thing as a teacher to know is that do not cause this selective mutism to worsen by putting on the spot. At the same time, something that teachers need to do is to work with a team, including student support staff, parents, and others who can help plan and implement a set of effective interventions to address the student's selective mutism and related problems. So, for example, this plan needs to play out as a continuous personalized process and proceed in gradual steps that maintain a good match motivationally and developmentally. The student needs to understand the plan and, as feasible, be a partner in this development and implementation. The student really needs to understand that there is support or help always available from the teacher, other adults, and even classmates. So, how do classmates play a role? They're affected by being a part of this. They are a part of the team of helping their students. Today, I was involved in a Twitter chat on empathy. And something that I learned is how kindness is related to this whole process. And this can be applied exactly in this learning disability case. Actually, the Twitter chat was on learning disabilities. So, furthermore, the classmates need to understand the situation and be encouraged to interact positively with the student. So, there's no hiding anything from the other classmates. They're directly involved by helping out. Everyone needs to help minimize this anxiety producing situations. So, what are anxiety producing situations? They can include activities that threaten the student's feeling of competence, self determination, and relatedness to others. So, everyone needs to help out in order to reduce the anxiety that students face. And lastly, an increasing emphasis should be on reducing reliance on extrinsic rewards in order to maximize intrinsic motivation. So, for example, providing diverse learning options that are of personal interest and enabling student choice. So, this helps the student while he or she is being assessed to not have this worry, fear, or anxiety. The study completed by Cunningham and others described how, contrary to predictions, the children with SM will not fail at school. From their study, they described how the math and reading scores of children with SM did not differ from those of the control group that they used. Although teachers tended to rate reading skills as lower in children with SM, the absence of group differences on objective academic tasks were supported by teacher ratings of mathematics and general classroom performance. Another important factor that especially parents would be concerned about is their children being bullied in school. And something that came out of this study is that children with SM were not victimized more than controls. and the control group was the children without SM. So those factors, those statistics are great. So Curvat describes how different approaches or strategies that children in the classroom should have with other children who have SM. For example, one thing she described is telling the other students about the child who may be selectively mute, about his symptoms when the child is not present. Curvat describes that the teacher should encourage the other students to be his friend and include him in all activities, to don't try to make him talk, don't say to people he doesn't talk, and do not yell out or overly respond if the child should speak. So basically, her advice is to just be normal and continue on with your activity. Another aspect that Curvat really highlights is to just not make eye contact at first with the student who may be selectively mute. The tips she gives is to talk to the child about ways he can communicate with the teacher. For example, the child can nod his head yes and no. The child can keep cards on his desk to answer yes and no, using a pass to go to the restroom. All these things, the child's anxiety can be reduced. The teacher can assure the child that she or he is not going to try to make him to talk, but need to find ways to communicate. And of course, let the child who's selectively mute know that if he or she ever feels comfortable enough to talk, that would be okay too. So the big lesson here is lose this idea that you're going to be the hero that makes the student talk. Rather, just focus on helping the child be comfortable in your classroom.
At first glance, 3-year-old Maya appears to be a perfectly normal little girl. She's confident, cheerful, and mischievous. But when people spend time with her, they realise something's missing.
Maya, can you tell me how old you are and where you're from?
Her voice. Maya has selective mutism. Maya can speak, but in front of most people, she chooses not to.
Would you like a fishbowl?
Instead, she resorts to noises and gestures to communicate.
I think she started being selectively mute about a year ago.
She stopped talking to people that were acquaintances of ours. If we bumped into people in the supermarket or whatever, she would just go quiet. Then close friends, she's just suddenly stopped talking to. And then within the last 4 months, she stopped talking to grandparents. And in fact, everyone.
You're not going to do any hickory dock for me? No. Why not? Should I go home?
What's baffled Maya's parents is that when she's on her own with her immediate family, not only does she talk, but she's an extremely confident and chatty little girl.
Hello, Maya. What are you? I'm an elephant. Is it fun to be an elephant? Yes. Look at this trunk.
I find it very upsetting. It's like people look at her and they think, well, can't she talk? Yeah, she can. They don't see it. They just see this child that says nothing.
Or grunts.
Or grunts. And that is a bit frustrating.
What are they looking for?
Oh,
A bear, that's right.
The key factor about selective mutism is that children can speak fully and freely in one situation,
that sounds like my elephant.
but not in others.
How come Peter's wearing a blue dress?
Selective mutism has been thought of as being a phobia. The child has acute anxiety about the expectation to talk.
When there's no expectation to talk during a car journey, Maya is extremely chatty and verbal.
When I grow up, I want to be Cinderella and the Tooth Fairy.
Do you?
Until she realises that she's arrived at a family friend's home.
Oh, my Auntie Jenny's.
We are at Auntie Jennings.
And at that moment, she completely shuts down and becomes silent.
When they're out and about, they're constantly on their guard, looking. You can see the sort of watchful, wary looks that they have, wondering if people are going to expect them to talk, put demands on them to talk.
So what else are you going to do on your birthday? What else are you going to do on your birthday, darling? It doesn't make sense to me. I can't make sense of her having this condition. You used to talk a lot, didn't you? Shh. Why are you saying shush?
You have to be quiet.
I have no idea how the next few years are going to be. What I'm concerned about is getting the right treatment for her. Do you think one day you'd like to talk to all these people? No?
Because I just don't know to talk to all my people.
While Maya's parents continue in their search for treatment, another family who knows exactly what they're going through are the Hancocks. Their 6-year-old daughter Louisa was selectively mute between the ages of 3 and 5.
Towards the age of 3, I realised that something wasn't quite right. As soon as she went into a group situation with friends, she would remain silent.
After extensive research, the couple found Alison Winkham's Selective Mutism resource manual invaluable.
It's helpful to avoid eye contact, which is rather different from how you'd normally talk to a child who has difficulty talking, and to avoid asking them questions. It's very helpful if people offer a selectively mute child the opportunities to speak, but not the expectation to speak. Sometimes when I'm talking to selectively mute children, I say, oh, I wonder if you might be somebody who likes drawing, or perhaps you'd prefer to do building. But I'm not expecting them to answer, but they just might.
It took 2.5 years before Louisa's mum finally noticed that her daughter was starting to show signs of improvement.
It was a real breakthrough. It happened to be on a play date. We had one of Louisa's friends just ran to play, as you do, and she shut the door behind her, which is not unusual. And I was downstairs, and all of a sudden I thought, I'm sure I can hear 2 voices up there. I went upstairs, and I thought, that's Louisa speaking. She's talking to a friend. And for me, that was quite an emotional moment.
Louisa's journey is testament that with hard work and support, this unusual condition can be overcome.
I can't imagine to stop talking now, as I now a chatterbox, so I don't think I'll ever stop talking again.
So, you may be wondering, how can we treat this type of learning disability? According to Muris and Olendick in 2015, their research showed that the main goal in the treatment of selective mutism to help children speak in situations where they previously did not speak. That's the goal. So in general, this can be achieved in 2 different ways, through psychosocial interventions or by means of pharmacotherapy. You may be wondering, what is psychosocial interventions? What do they include? So I'm going to give you a bunch of examples. They can include techniques such as contingency management. An example of that would be systematic reinforcement of speech behavior. Another technique is shaping. An example of that would be training the child to gradually increase the use of speech in specific situations. Another technique is prompting and fading, which is helping the child to speak and slowly removing these prompts so that he or she speaks on his or her own. Another technique is called systematic desensitization, which an example of that would be exposure to increasingly difficult situation while the child is learning to use relaxation to deal with negative emotions. Another technique that can be used is social skills training. An example of that would be enhancing the social competence of the child by improving verbal and nonverbal skills. And the last technique that I will mention in this section is modeling. An example of that is a child mimicking the effective speech behavior of a model. So, on the other hand, what is pharmacotherapy? Pharmacotherapy has also been proposed as another treatment option for children with SM. Why? Based on the idea that anxiety is a prominent feature of SM, clinicians have predominantly tried to treat the condition with selective serotonin reuptake inhibitors. So these are all different ways that you can treat SM. The anticipated routine was one major transition that occurs in a selectively mute child's life is going back to school. So, usually going back to school is such an exciting time. However, for the selectively mute child, we need to make the unknown known. So, how can you do that? The sooner you talk, the better. Meaning, talk about the return to school as frequently and as well in advance as possible. As a parent, you can point out all the positive things about the return to school, such as seeing a favorite friend every day, having recess outside with the big kids, or joining an older sibling in a new school building. You can talk to your child about things such as the anticipated routine when school days return, such as how the morning routine will go at home, how your child will get to and from the school, and what they're doing after school. Basically, you just need to get them back in that routine. Just basically giving them a heads up and planning ahead. You can even go to visit the school property before it even starts. You can even arrange play dates with a favorite friend on the school playground to get them to be there and not feel like, what are we doing here? You can just avoid the anxiety by being where they need to be to get over it, but in a comfortable approach, through a comfortable approach. So, in general, what kind of services are available for someone who, let's say, is going on to college or the workforce? A rehabilitation service is a perfect example of this. The Division of Rehabilitation Services, DRS, is available in every state. This is a program of state government that helps those who are disabled to achieve a lifestyle of independence and integration within the workplace, the family, and the local community. Funding is actually provided by state and federal funds. Eligibility includes a physical or mental disability that would keep a person from obtaining suitable employment or achieving a lifestyle of independence and dignity. Disability also includes those who struggle with learning disabilities. Yay! So if our child in this scenario does struggle with the learning disability, from them being selectively mute, then they would get the service. Things that are awesome about this service is that what they do is there's evaluation done to assess the nature and degree of disability, job skills, and capabilities. Vocational training may also be provided at a technical and trade school, business school or college, transportation, books, driving lessons, tutoring, assistance with finding employment, and on-the-job training. Isn't that just awesome? And from this website, there was an entry from an adult who's actually had an experience getting a job. And what their exact words were, "Hey everyone, we're almost towards the end. I need you to close your eyes and imagine a selectively mute me. Not really me, but a child. So, temperamental inhibition. This child is timid, cautious in new and unfamiliar situations, restrained, usually evident from infancy on. Separation anxiety as a young child. For this child, they want friends and they actually need friends. However, some just do not have the social skills necessary. Physical symptoms of a child who is selectively mute is mutism, maybe even a tummy ache, maybe even nausea or vomiting or joint pains or headaches or chest pains or shortness of breath or diarrhea or nervous feelings and scared feelings. This all comes from the anxiety. How does the child look? Many children with selective mutism have a frozen-looking, blank, expressionless face and stiff, awkward body language with lack of eye contact when feeling anxious. This is especially true for younger children in the beginning of the school year, or then suddenly approached by an unfamiliar person. Emotionally, when this child is young, he or she may not seem upset about mutism since peers are more accepting. However, as children age, inner turmoil often develops, and they may develop the negative ramifications of untreated anxiety. Symptoms can include being a picky eater, having bladder issues, being sensitive to crowds, maybe even lights, maybe even sounds, even by being touched. They have heightened senses. And within the classroom, a child with sensory difficulties may demonstrate one or more of the following symptoms: withdrawal, playing alone or not playing at all, hesitation in responding, being distracted, not being able to maybe follow a series of directions. So I hope you can get a great idea of what this person's senses are: hearing, touching, feeling, smelling. Just remember though, maybe all these that I described do not happen to every child who is selectively mute. Hey everyone! Okay, so we're at the very end. I just wanted to wrap this up with a little quiz. True or false? Number 1, selectively mute kids can speak and communicate in settings where they are comfortable, secure, and relaxed. I'll give you a second. The answer is, drumroll please, true. Number 2, a selectively mute child can never overcome this disability. I'll give you a second. Drumroll please. The answer is false. Number 3, students who are identified as selectively mute will all fail in school. Give you a second. Drum roll, please. False. And last but not least, number 4, the best way to help a child who is selectively mute is by reducing his or her anxiety. I'll give you a second. Drum roll. The answer is true. So, Just some more comments before I end this. Mutism is not the same as autism. If anyone was confused about that, they are not the same. Something that you can do as a teacher or as a parent if you wanted to educate your children about selective mutism is you can read them a story such as Shy Charles. Lastly, according to Klein and Kovac in 2013, you can play games with them, which is awesome. Games include Guess Who, Spot It, WizKids, Magic Tricks, Head, Thumble, Battleship, Chess, Checkers, Backgammon, Bingo, Simon Says, card games such as Uno, Go Fish. All these things are used to just help them talk. So I really hope you guys enjoyed this presentation. Again, if you have any questions, email me. And I'm really happy I did this and got to learn about selective mutism. Thank you, everyone. Have a great rest of the summer.